Good afternoon, everyone. A warm welcome to our Policy Modelling for Health lunchtime webinar series. I'm Professor Petra Meyer, the Director of the Policy Modelling for Health and Professor of Public Health here at the University of Glasgow. Policy Modelling for Health is funded by UKRI as part of its £35 million Population Health Improvement Network. This supports innovative research aimed at tackling the wider determinants of health and reducing inequalities. Our work is focused on developing advanced computational models to help policymakers explore the likely effects of different policy choices on health outcomes across society. And we have a webinar series which offers insights into our activities presented by members of the research team. Each talk is designed for a general audience, but with opportunities to ask questions at the end. Recordings of events will be available on the website. Today, I'm delighted to introduce our speaker, Julian Cox. He is a Policy Modelling for Health Deputy Director. Julian is Assistant Director of Research at Greater Manchester Combined Authority. At GMCA, Julian and his team support policymakers across a broad range of areas, including health, housing, the economy, crime and social services, providing data, evidence and insights to support decision-making. In today's webinar, he will introduce our consortium, who we are, what we do, and why our work matters. Please feel free to submit questions anytime via the Q&A tab, and we'll come to these at the end of the presentation. Julian, over to you.
Thanks, Petra. As Petra said, I am going to do quite a broad overview of policy modelling for health, but I'm going to focus on people, partnerships and purpose, because what makes this project work is all the different elements and how they all fit together to achieve our purpose. So you see a picture on the bottom of the slide there of one of our full team meetings. There's a broad range of people bringing lots of different experience from different academic disciplines, different policy experience, and it's how they all fit together and work together that really makes this project work. So I'm going to talk a bit about the purpose to start with, and why policy modelling for health as a project matters. So as we all know, things that like taxes or welfare or housing or pensions or work really do have a big impact on people's health, but we don't always know exactly what the mechanisms are and how it plays out. So that's where modelling can help us understand that, to make sure that when we are deciding on different policies, we understand what the effects are likely to be. We understand who's going to be benefiting or potentially losing out from different policies, different communities, different geographic regions, etc. So the computer models we have in our consortium will help policymakers test things out better. So how do they understand what might happen in the future, and how can they optimize their decisions and optimize the policies that are implemented to shape a fairer, healthier country and making things better for everybody. So that's what we're trying to achieve. As Petra mentioned, we are part of a wider partnership. So this is one of the first partnerships we'll talk about, which is we are one of 4 consortia in the Population Health Improvement UK programme. So that's a £35 million UKRI funded programme established in 2024. And you see on the right-hand side, there's 4 consortia in that network at the moment. So we are one of 4. The other ones are Population Mental Health, Healthy Urban Places, and the final one called Local Health and Global Profits, which is all around commercial determinants of health and how they might be influenced. So whilst we're working on our consortium, we're also working closely with these other consortia, and in particular the modelling we are creating will be of help to the other consortia. So it's not just us on our own, there's a group of us working together. And to recap our vision again, so we are trying to help support a better evidence base of the potential health benefits or harms of policy choices, and in particular economic policy choices, and what might happen individually but in conjunction with different policies, and where those benefits fall. So we're building on previous projects. So there was a project called CIPHER, which a number of people in this consortium were also involved, and it was also led by Petra. And that developed a number of different modeling programs. It's a systems science project, and we are building on that. And we've added in new partners and new sort of models, and so we're building from a really strong base from Cypher. And this slide sort of sets out sort of how things sort of feed through in the project. So we'll start on the right-hand side, and it's really understanding the needs and priorities of citizens, policymakers, and then advocacy groups. So what do they need to sort of what their views, how might models help meet their requirements? So the models are then developed to bring in all those insights and needs from the right-hand side. We then create the models to estimate effect on economic circumstances, but crucially at the same time, what that means in terms of health, because they both interlink very closely, and it's a bi-directional feedback between the two. And those models then will create predicted outputs, which we can then feed into the policymaking process. So policymakers can think about economic challenges they have and what their policies might do to change those, but crucially at the same time think through what that means in terms of health and health inequalities as well. So it's all about how we can build these models, take them through into the policy making arena. So there's quite a few of us involved in this project. So that photo at the start, and lots of different people involved. So where I said, building from Cypher, and so some of the academics were part of Cypher as well. So we've got six academic partners: the University of Glasgow, University of Strathclyde, University of Leeds, University of Sheffield, University of Birmingham, and University of Essex. Birmingham and Essex are new to this project and bringing in sort of policy and modelling expertise to strengthen the original tools we had. And then importantly, we have 4 policy partners who are deeply embedded in the project. So there's my organisation, Greater Manchester Combined Authority. We were one of the policy partners in Cypher, along with Public Health Scotland. Also added in the West Midlands Combined Authority and Glasgow City Region to sort of build out from those 2 policy partners, and they are really crucial to sort of set out what the policy needs are for their organisations, to help the academic side and the modelers to really understand how we might develop the tools to help answer the questions that those policy partners have. Broader than that, we also have partners from a wider set of organisations. We have a policy working group and a think tank advocacy working group, and you see on this screen the sort of logos of some of the existing members of those groups. So they meet every 6 months, and the idea is that they provide other input about their policy questions and needs. They help us shape the work and ensure that what we create will be useful to not just the 4 core policy partners, but the wider policy making infrastructure and people. These are really useful to help us shape the work we do. We're open to new members for these groups if anyone's interested, as long as you've got a real sort of interest in how modelling can support policy making. We'd love to have you helping out with these groups. Right, so going back into the consortium itself and how we're structured. So we're trying to integrate 3 key themes here. So at the top, the red one is around the computational modelling. So this is the hardcore coding type elements of the project. So we have a synthetic population, which is a representation of the population that we can feed into the models, and that's being built out of original Cypher population. But then there's lots of different tools that's come together, which I'll explain a bit more in a minute. And it's integrating and evolving those models. The yellow theme on the left is around enhancing policy utility, so making sure that the models are of use to policymakers. This is where the four policy partners really come together, and we have an embedded researcher in each of those four policy partners who is full-time to work to try and translate policy into the academic sphere, but also really understand what the models are doing and how we might run them locally in policy organizations to help with decision making. So real two-way link to ensure that the project fits together. And then the third green element is building on something we did in the Cypher project, where we knew there were things that models couldn't tell us about the real world, and we wanted to get some citizen insight into our decision making alongside the models. So we have community panels that are being set up for this project, like we did in Cypher, but they are giving us a real world view about how things happen, and to ensure that we're not missing things in our modeling. Ideally, we'd like to integrate as much of those insights as possible into the modeling. Sometimes we'll have to just present it alongside the modeling to provide the wider view of the system to enable policymakers to make the right decisions. Okay, so moving on, co-production, you probably gathered already, that is very critical to the success of this project. So we are building out from having a shared leadership of the overall consortium between the policy side and the academic side of the consortium. I mentioned the four embedded researchers already. They're really critical to make sure we get the right priorities in our work, make sure we can create models which are useful. We've got the wider groups, including the community panels to help bring in a wider set of insights. But the main aim is to try and create these tools that anybody can use, open to anybody who's got sort of interest and skills in using models. They'll be open source for people to use outside of the consortium and into the future. So that's what we're trying to achieve, and really making those models have some real world impact. Briefly mention where we're looking in terms of policy topics. With models, there's always limitations on what you can do with one single model, and so we've tried to sort of match make the policy sort of priorities of the organizations with what the models we have in policy modeling for health are really good at. So there's some things we've had to park because the models don't lend themselves directly to it, but we've got a really strong set of policy topics here, which we think we can get some really great insights into through using the models. So at the top, we've got economic inactivity, in particular related to poor health or disability. And then we've got housing in terms of housing quality and affordability. We've got skills of individuals. We've got whether people are in good or fair work. And the final one is one thing we didn't do in Cypher, but we really think is crucial to this project, is adding in an understanding of wealth and debt, because we believe that is really important alongside things like income in determining people's life chances and ensuring that we have the broad picture of what happens to people over time as they build up that stock of wealth or get into more debt. So we're focusing all our modeling around these topics, and the models I'm going to go in a bit more detail now about the individual themes and give you a bit of a flavor of what we are doing in practice. So the computational modeling theme is trying to mesh together a number of different models. So we have at the top the Minos model, which we've created in Cypher, but one of the key models we're adding to the suite is the SIMPATHS model, which brings together a good understanding of the tax and benefit system alongside other sort of economic and work sort of elements to bring together. So we are integrating these models to get a broader view of all the different elements of economic policy that link together and improve economic outcomes, but also improve health outcomes. And the approach we have in this consortium is dynamic spatial microsimulation. So if you're interested in learning more about that, there was a previous webinar that colleague Corinna Elsenbroich did around microsimulations, a bit of an overview and introduction. So look back at that webinar and it'll give you a really good oversight of what those sort of models do and how they can be used. So in particular, I mentioned the wealth and debt element for these models. So this is a sort of diagram of how wealth and health fit together. So there's quite a lot of work to sort of review the literature, understand the relationships between different elements of health and different elements of wealth or debt. So we now need to sort of develop the parameters in the models to and feed those into sort of extra modules within our modeling suite. So that's underway at the moment, and hopefully soon we'll have these added into the model, so to enable us to get that dimension in terms of people's lives and how that impacts their outcomes. On the policy utility side, we are, as I mentioned before, trying to make sure that these models are really valuable to policymakers. We're trying to sort of ensure that through testing that the embedded researchers are doing, that understanding the challenges of running models in a policy organization, as well as what the benefits are and how we can sort of make sure that they are as fit for purpose, fit for use, make sure we've got the right skills and think about training needs, etc. And really integrating the policy and academic parts of the consortium. And one good example of what we've done so far is to really explore what makes a good model. So again, there was a webinar on this that Lisa Garnham did end of last year, which will go into more detail on this, but we have created a sort of a suite of criteria to help people understand what makes a good model. And there's two elements of it. On the left-hand side is what makes a good quality model. So obviously it has to be simple and have good data in it and be well validated and be clear and documented. But crucially, we need to also ensure it's actually valuable and relevant to the policy side. So has there been strong input from policymakers in its development? Are we clear about how it's framed and connected to policymaking? Is it open for scrutiny, and can it be embedded long term in decision making rather than just a one-off interesting academic exercise? So this is helping us ourselves make sure that the policy models we create are useful, but also hopefully for other people who are thinking about policy modeling, it will also help them too. And the third example I'm going to go through is around on the democratizing modeling. And again, this whole theme is about making sure we don't have blind spots where the data doesn't tell us about what really happens in reality. So it's bringing in community insight to help us understand lay perspectives and make sure we can either incorporate that in the modeling or present it alongside the modeling. And we have got community panels, and the first of those has been operating at the end of last year in Inverclyde in Scotland. So this was a technique called photo voice, where 7 participants who are young people transitioning from school to work took photos of challenges and support that was provided to them on their way, and that helped discussions and bringing together sort of systems maps about what some of those support and challenges might be. So that insight from that will be feeding into our analysis, but also on its own will be presented back, and there's going to be an exhibition of that in Glasgow in the near future. So that's a few examples, and I'm just going to finish off with 2 slides. One is about the outputs we set out at the start and what we hope to achieve by the end of our 4-year project. So top left, we've got that we are creating an open source synthetic population of Great Britain. So building on that CIPHER synthetic population, which is already out there, we've done lots of work, and we're getting pretty close to having an upgraded and improved version of that synthetic population, which will be available at not just an individual level, but also a household level. So that'd be useful on its own, but also it's critical to feed through into some of the microsimulation models that we and other people will be using. And yes, that modeling infrastructure is core to to what we are delivering. And as I said, it will be available an open source for people to use and incorporate in their models. We want to understand really how models are used and how we can sort of explore how we can strengthen and broaden that. So mapping out what's in use currently across policy settings. And linked to that in a way is making sure that people do understand what the opportunities are for modeling and training and in-person and online things, such as this webinar, indeed, about sort of improving model literacy, so ensuring people to understand what the pros and cons of using models such as the ones we are creating are going to be. Top right, we're looking at things that we might not get to in this project, where there will be some missing dimensions undoubtedly. So can we sort of understand what the next steps might be after we finished, making sure we are getting the right data collection and things like that for future modeling. Going on to the second one on the right, one of the aspects of the democratizing theme is to ask different sort of people in well, different groups, big data sort of surveys about social preferences. So can we understand better what people want from public services? One of the interesting questions is, are people keener on overall improvement for society or reducing inequality? So there's always a trade-off to be made between those two elements. Trying to quantify some of that is something that we started in CIFER. We're going to continue in the Policy Modelling for Health project. Finish off the last two, the second to last one there, co-producing guidelines. So helping policy makers and think tanks make best use of our outputs. So how can they take what we've done and help feed it into their systems? And then also some sort of guidance on the democratizing side. So a toolbox of some of the creative and visual methods we've used with the community panels to help others think about how they might also take a similar approach to feed into computational modeling of any sort. So that's what our outputs are. And my final slide is setting out what we said at the start of the project about our vision within the period and longer term. So on the left-hand side, this is what we're trying to do within this 4-year program, making sure we have created new evidence that helps inform policy direction and agenda setting. Hopefully that will then start to sort of lead into some early effects on economic determinants of health and health itself. Want to make sure these models that we're creating and all the other outputs are available and in use by the policy partners within the consortium, but also wider sets of partners. And we're always keen to add in new academic or policy partners as appropriate to sort of think about how we can spread this further. And then jumping over to the right-hand side, this is all around trying to have that long-term impact. Can we use models to help decision makers be more effective in their policy interventions and delivering them at scale, leading through to what we're all trying to achieve in terms of improving population health and reducing health inequalities. So that was my last slide. And I think it's now for me to hand back to Petra to chair the question and answer session.
Thank you very much, Julian. What an excellent summary of our work. We now have opportunity for some questions. If you have not already submitted them, please use the Zoom Q&A tab at the bottom of your screen, and we will get to as many as time allows. Julian, how can organizations or individuals engage with or benefit from the consortium's work?
Yeah, that's a good question. So there's a number of different ways. So obviously coming on to webinars like this hopefully is useful for people, but some people might want to get more involved. And I mentioned before, if people are interested in joining those working groups, we have got some space on those to add a few new members. So please get in touch with us and we'll try and add you to those. So that's one element. The if you want to just find out more general information, there is a newsletter that comes around, and some of you might have found out about this webinar from the newsletter. So please do sign up for that. And we have a website which is currently going to be enhanced. So we'll be sharing more information on the website as well, that some of the outputs as they continue to develop. So lots of different ways. Please, if you're interested in getting more involved, just get in touch, and we'll try and work out what the best way for that to happen is.
Julian, do you want to stop sharing? So
Oh yes, we'll do. Yeah.
These both on the full screen, and whilst you do that, I can ask you the next question. So a key criticism I've had previously is that modelling is based on existing information and health behaviours. How can we defend this when modelling outputs over a longer time period? So, you know, we're looking 10, 20 years ahead. And population and health behaviours may be drastically changing. So you know, how does that work?
Oh, that's a tricky question. I have to come back to you on this one, Petra. But I guess my view would be that models are not the whole answer. They are helping in the decision making process. So they are useful to help test things out. But we do have to put assumptions into the models. And if we think things are going to change, we need to sort of ensure our models are able to think that through, or do different sensitivity tests about what might happen in the future. So they're still useful to test things out and see what the potential variation in outcomes might be for different assumptions in the models. So I think, yeah, they're not going to be perfect. They're never going to be perfect. Prediction is never perfect, no. But hopefully it still gives us some useful insights to better than not having the models to make decisions.
That's right. How do you plan to collaborate internationally is a question here. Would it be replicating the steps or training?
Good question. We do have interest from lots of people, and but again, we're open to. We've got one policy partner in the wider groups, which is the World Health Organization. So they have a much broader international remit, obviously. So international partners can get involved. I think our models are built around the UK, because that's where our synthetic population is based, and the things like the tax and benefit system is relevant. But so if they want to do that more internationally, they might have to change some of the metrics, but they could still take some of the tools and not be starting completely from scratch. So I think
I'd probably say it's about method sharing. It's about sort of working out what tools might or might not work elsewhere, but the models themselves are very UK centric because they're built on UK data, I would say. So this probably it could be the final question, or we'll see whether we can squeeze another one in. How can a student who's currently working on a health policy related research project benefit from this group? What kind of data from our work would be relevant for modelling, or what kind of data from their work might be relevant for modelling?
Yeah, it depends exactly what the project is, I guess. But there's certain things like the synthetic population, which is really relevant to any sort of analysis around health policy. Enables people to understand the current spread of different outcomes. So just a bit more detail on that. So it's a combination of census data and understanding society data. So it gets a really rich data set of lots of different measures at an individual level, but it's not real people. It's synthetic. We are taking attributes from those surveys and applying them to a population which is representative of the UK population, and we do lots of testing to check it does match, although it's synthetic. So that is a really useful tool for people to sort of use in quite a lot of other work. But there might be some more, depending on the policy area, there might be some other opportunities to get more involved in some of the other modelling. So I suppose, again, get in touch and talk to us about what you're interested in, and we'll see what the linkages that could be made are.
So in the flow you showed, it seemed that a synthetic person's debt doesn't directly affect assets, though presumably it does. Is that handled behind the scenes of the synthetic individual's finances before it reaches the policy modeling, or what works? I mean, I guess that's because you showed a very, very simple flow. So maybe just a sort of, you want to.
Yeah, so because I'm not the expert on that specific bit of work, but so I just reading the question that's in the chat here. So it just seemed that yeah, that's being coded at the moment. So we're not quite sure exactly how it's going to work in the model, but we need to make sure that there is those linkages obviously between debt and assets. So it's the way the models work is as an annual sort of time step which flows forward. So things in time step 1 feed through to time step 2. So over time, some of those relationships between debt and assets will be really crucial, and I'm sure that the modelling teams are incorporating that. But I don't know the nuts and bolts behind the modelling that they're doing on that, so I can't completely answer that question, I'm afraid.
Yeah. If you want to get in touch, send us an email and we can elaborate quite a bit more on exactly what goes into the models. It's complex flows and causal analysis and so on, as Julian says. What training is currently available for researchers working on this to improve their modeling literacy?
Yeah, so one of our work packages is all around model literacy, and I suppose we're starting with some of these webinars actually as part of that training sort of suite. But we will be doing other things, and that work package started a bit later than some of the other ones, so it's still relatively early days. But we'll be building up other documentation and probably more in-depth training as appropriate. So if you've got ideas about what training you'd want to see through the project, please again get in touch and suggest what sort of things we could offer, because we're trying to be responsive to different training needs.
That also ties in nicely with our final question that we've got time for. What types of policies or health challenges does the Policy Modelling for Health Consortium get requests to focus on, and how do we manage the requests?
Yeah, so that's a good question. So I put on the policy topics that we're currently working on, and I suppose one that probably gets the most interest is the economic inactivity element, because that's been such a big policy focus in the last couple of years, and so that's one which is definitely part of what we're doing. We also get other questions, I suppose, which we can't manage, because I suppose things like transport, for example, and that economic our models don't have a spatial sort of network underneath them. They've got all the people in the models, but they don't understand the transport network, for example. So some of those things other people do transport modeling, and maybe we can incorporate some of our learning with other transport models, and that's part of our work to think about how we can integrate different models. So there are the different things we need to manage when people come and question. So through the working groups, for example, people will be suggesting ideas. So it's the role of the policy team to then think those through, articulate those to the modelers, and understand whether the models are able to do what we need or not, or whether so some things wouldn't, like that transport example, it's but arguably we could do it, but it'd be a massive investment to change the models to add in that, and it's not in the scope of this project. So other things, there are opportunities to tweak the models and add in new elements to make sure we can answer some of those questions. And that's that two-way partnership between the policy partners and the academics that helps us get to a good match.
Thank you so much, Julian. This concludes our Q&A. Thanks for joining us today and for all your questions. A full recording will be available on the website next week. So please share it with colleagues who were unable to join us today and who may be interested. The next in our lunchtime webinar series will be on the 19th of February. This departs slightly because it's not just about HealthMod, Policy Modelling for Health Consortium, but it's me reflecting on my experience of leading large and complex research programs I'll share some practical strategies for writing large grants, fostering interdisciplinarity, managing collaborations, and just generally sustaining impact in large-scale research. I'll also discuss challenges that can arise in such work. So I hope the session should be of interest to anyone who is or wants to become involved in leading ambitious multi-partner projects. To register for this and any other webinars, please just follow the QR code or go to our webinar hub. So I would also invite you to subscribe to our Policy Modelling for Health newsletter, which provides quarterly updates on our work and upcoming events directly to your mailbox. Details will be sent with the event recording. So thanks again to our speaker, Julian Cox, and to all of you for joining.